Eat this, drink that, go.
Remember, the wait times at the HCA East Florida Hospital emergency rooms average in the single digits, less than 10 minutes. All you have to do is go to hcaeastflorida.com. There they list all their wait times for all their emergency rooms, and they update those times every 30 minutes. You'll be ready in case of an emergency. That's hcaeastflorida.com. Hey, here's a good question for you. Good health makes good babies. You heard the phrase, you are what you eat. What about your newborn? What can you eat? What can you drink? And I know what the number one question is, why you're pregnant, right? We're pleased to be joined this morning by Dr. Adrian Roznowski, HCA Advanced Women's OBGYN Institute of Broward. Hello, doctor. Good to see you.
Thank you so much for having me.
Yeah, okay. Number one question is, can I have one glass of wine? And can I do it in the second trimester or the third trimester? Will anything happen to the baby?
Well, the current research shows that alcohol is not encouraged in pregnancy, and women should abstain from alcohol throughout their pregnancy.
Yeah.
Yes.
But they ask you, don't they?
I always get that question.
Hey, do it. You know, put it this way. The reason I was not born a woman is because I would never make 9 months without having a glass of wine. I'm convinced of that, let alone the birth. Well, let's not even go there. I don't even talk about that. Most of us recognize the importance of eating well during pregnancy. How healthy are most pregnant women that you see?
I am happy to say that most women are pretty healthy and they own their pregnancy. They look forward to having a healthy pregnancy. I see most of my patients about 6 to 4 months before the pregnancy, and we form together a plan. It's called a preconceptional counseling visit, and we go over diet and exercise, and we start prenatal vitamins at a early time,
right.
and we talk about what to expect during pregnancy, what kind of shape to get yourself in as you lead up to the pregnancy, and from this plan comes something that incorporates diet, exercise, and lifestyle choices. Pregnancy should be looked upon as a marathon. And what do most athletes do before a marathon? They get themselves in the best possible shape. Yeah. As you get yourself in the best possible shape for pregnancy, you allow to gain 15, 20, 25 pounds tops, and allow your body to take this extra weight gain, this slowing vascular rate, and you will deal with it with flying colors. Most women should exercise during their preconceptional period, as well as continue just about every single exercise throughout pregnancy.
All the way.
All the way. There are very few types of exercises that are not encouraged in pregnancy, but just about every single exercise, as long as it's being discussed with your doctor, can be continued. Some types of pregnancies, such as high-risk pregnancies, do discourage exercise. For example, there is a type of pregnancy where the placenta is low-lying and may cover the cervix. In that type of pregnancy, exercise is not as encouraged because the woman is at a higher chance for preterm labor. Most pregnancies are low risk, and the doctor with the patient come up with an exercise and diet plan.
Right. Brenda, you're the only one in this conversation who's been pregnant.
Do you encourage natural births? I mean, is that?
I really do. Okay. And a natural birth comes into this whole healthy lifestyle, healthy eating, healthy exercise. It allows the body to recover the quickest, and it allows bonding between the mother and the baby to occur right away. The recovery from your average C-section is 4 to 6 weeks, and there is pain involved, and any kind of pain may...
Recovery's longer?
Recovery's way longer. The recovery from a spontaneous vaginal delivery with minimal tears can be 2 to 4 hours. So just think of the difference in that immediate time that the mom has to start her life and to bond with her baby between the two types of deliveries.
Right. And for a normal pregnancy, what would be a normal diet? I mean, what should be the diet?
So a normal pregnancy should focus on a very healthy diet, high proteins, minimal sugars, a lower intake of salt. There used to be a dogma that pregnancy is the time when you can just eat as much as you want, gain as much weight as you can.
So you don't eat for 2, you still eat for 1?
You still eat for 1, and you eat for 1 in a healthy manner. most women are supposed to gain about 15 to 25 pounds in pregnancy, and I know, back in the day,
I doubled it.
Yeah, it's easy. Well, I guess it is.
I ate for 2.
I hear that quite often.
Yeah.
And that is one myth that we are slowly dispelling as professionals. And the other myth that is that we're trying to dispel is when the weight gain occurs. Usually babies grow the most in the 3rd trimester. So a minimal weight gain the 1st, 2nd trimesters is healthy, because you will gain those 15, 20, 25 pounds at the end, whether you want to or not.
And women are sometimes are concerned because they're not gaining that weight in their first 2 trimesters.
Yeah, that's what happened
Yeah,
to me.
imagine.
And then I just
Let's
said,
eat.
okay, I
Right.
will eat and eat and eat and eat and eat.
Dr. Roznowski focuses on minimally invasive and office-based gynecological surgeries. Most of the patients you have go home that day, correct?
That is correct. Unless there are high-risk conditions, most GYN surgeries are performed on an outpatient basis. We're talking about hysterectomies that can be done with 3 extremely small ports, 1 to the belly button and then 1 on each side, with a vaginal repair. And the typical patient will go home 4 to 6 hours after the surgery is done. Has a couple of days to recover and can resume her life in like a week or 2.
Well, I'll tell you what, the science has changed so drastically for what you do and the way it was when you had
Right.
Danielle. Are there birth defects that can occur because of poor diet in pregnancy?
Very little. What we mostly try to caution women is infectious processes that occur during pregnancy. So one of the important things in pregnancy is not to eat too much raw food or unpasteurized dairy products. I usually try to discourage women from eating sushi or even going to Japanese restaurants, because a lot of times the chefs will handle raw
Right.
fish
Right.
and then cook their food. And the major risk for this is salmonella or listeria poisoning.
Man.
As far as birth defects, one important thing I want to touch upon is toxoplasmosis. So toxoplasmosis can lead to birth defects, and usually most women can get it from cleaning the kitty litter. So, it's
Interesting.
transmitted from cats to humans. Most humans are immunized by it, but if
Right.
someone is not and has a cat,
Yeah.
what I encourage is for the husband or the partner to clean out the
To do
kitty
the
litter.
work, yeah. No, that's an excellent point. How can someone make an appointment with you? How do we find you?
Right.
It's very easy. I work in Plantation. I cover Plantation Hospital and West Side Hospital. And my address is 8251 West Broward Boulevard,
Right.
Suite 300, Plantation, Florida. Phone number 954-476-1050. I also host a professional Facebook page. So it's Roznowski, Roznowski, and then space OBGYN. And that is a page. I am very quick to answer questions, and I can assist you in any way that I can through that page as well.
You know, that's a wonderful way to communicate with patients. I mean, you talk
Yes.
about the modern element of social
Exactly.
media to be able to
I'm
talk to
thinking
your
about
doctor
getting
that way.
pregnant. What do you know? What's your advice?
how do you-
Yeah.
well, if you don't know that part of the deal, you probably got some real problems. What kind of minimally invasive procedure are we talking about, doctor? What kind of things?
So the most common minimally invasive procedure is a hysterectomy. So for somebody who has abnormal uterine bleeding or fibroids or just an enormous amount of pelvic pain that is unresponsive to medical management, the procedure is taking out the uterus. So,
Right.
so that is the most common procedure that I perform. The second most common procedure that I perform, I actually work with quite a few oncologists, and I work with women that are BRCA positive. Women that are BRCA positive.
And what is that?
So BRCA is a genetic predisposition to breast cancer, but it also predisposes to ovarian cancer as well.
Okay.
So in somebody who has done childbearing or over 35 and is positive for this BRCA mutation, the necessary procedure, if the patient consents to it, is a mastectomy, which is
Right.
removing the breast, as well as a oophorectomy, which is removing the ovaries. So
Wow.
the breast surgeon performs the mastectomy, and I do an
other work.
outpatient laparoscopic.
Unbelievable.
correct.
We're going to say goodbye to you, and we'll see you next
Yeah,
time.
we'll see
Thanks,
you next
Doctor.
week on Eat
Thank you
This,
so
Drink
much
That,
for
Right
having
here
Go.
on Eat This, Drink That, Go.